Well, welcome to Wellness Talks. Man, I have been meeting some of the most amazing people in the health and wellness space for the last several years, and they have been personally responsible for making sure that I maintain my health and well being, but also that I'm introduced to quality, bioavailable products, technology, trends, innovation in the health and wellness space. And I'm like, how do I share all of this with my community, my friends, my family, those who always have questions about my skin and my hair and, my aging backwards and just this vitality that I have. And I always say that, my fountain of youth is the presence of God. I spend a lot of time in prayer. I spend a lot of time literally sitting and soaking and listening and receiving in his presence. But I also get up from that place and I do a lot of practical things as it relates to my health and well being, as it relates to just my professional development. And it's not just about exercise, right? We know that a holistic approach to wellness doesn't just include exercise, it includes diet, it includes nutrition, it includes how active you are. It includes the quality of the supplements that you do take. It includes herbs. It includes, modalities in the health and wellness space that really can contribute to your overall well-being. And so today on Wellness Talks, I have Dr. Karim Khan. And Dr. Karim Khan brings over 20 years of extensive experience in healthcare, ranging from inpatient care for patients with acute chronic issues. But even early on in his career, Dr. Khan focused on peripheral interventional cardiology, contributing to clinical research on FDA approved devices for vascular disease. He has overseen patient safety indicators and hospital acquired condition reduction programs at one of Georgia's largest teaching hospitals. He actively promotes and teaches healthcare quality, and he has served as chairman of the Best Practice Committee. Additionally, he has contributed as an assistant professor at Morehouse School of Medicine, which is one of my amazing places to be right now. This is my school right now, teaching clinical research methodologies and clinical research manuscript formation to second and third year residents. Realizing the need, Dr. Khan transitioned to functional medicine and healthcare management, which is where he and I intersected as a holistic wellness practitioner, nurse midwife in training, working in the maternal health space. Not only is it really important for me to find quality products for my clients, both prenatally and in their postpartum, but also for me to keep my vitality, to keep me very spry. And so Dr. Khan and I met recently, and he was an answer to prayer. I love when God sends me these God sends. I love when he sends me amazing people that I can connect with to help improve the quality of life of those that I serve and those that are around me. And it just seems within the last, year, I have connected with people who are dealing with some type of chronic disease. They just had a baby, they're having some chronic health conditions, and I'm like, what is the solution? And so through my research, I've been able to develop a detox protocol, but I also realized that the liver and the gallbladder need support. And I was looking for a product. I was actually doing research and met an amazing former NFL player who you'll be meeting soon on these wellness talks, who connected us. And so he introduced me to this amazing product. And I want him to share the wealth of information that he has, not only about the product and the company that he works for, but I also want him to talk about why you need a liver detox, why the gallbladder needs to be filtered, why it needs to be purified. We're developing this amazing wellness campaign via social media, and we want to invite you to the 5-day liver detox challenge. I'm starting my personal challenge on April 1st, and then after I complete my 5-day challenge, I'm going to be inviting many of you to participate in a 5-day challenge with me. And so without further ado, I'd like to introduce to you Dr. Khan. Welcome, Dr. Khan, to Wellness Talks.
It's wonderful to be here.
Absolutely. I'm so excited about this amazing product that you have curated. You have an amazing company. I want you to share who you are, share about your company, and how you came to this amazing formula that's going to help so many people.
Definitely, definitely. And I'm excited to share all the experience that I have had for the past 9 years. It's about 9 years that I got involved in the functional medicine space. You know, being a traditional medicine doctor, it's a very difficult to transition into the functional medicine space because that is not the training of traditional medicine. We never learn about functional stuff like supplements, vitamins, and their deficiencies in traditional medicine. When I got involved in the functional medicine space, I focused mainly on gut health. And there I learned that one of the most important organ, that is liver, was very, very underrated. And liver actually get the highest hits when it comes to inflammations, free radical damage, toxin damage, and so on. So I focus a lot on liver health, and what I did, it's been 7 years now that I have formulated a protocol for a liver cleanse, liver and gallbladder cleanse, because a lot of people would come and their complaint was as such that I would focus on the liver health. You know, uh, liver does a wonderful job all the way up to the age of 40. And after the age of 40, something happened and liver start to lose its functionality slowly. And that's why we succumb to a lot of these chronic diseases like blood pressure, cholesterol, diabetes, and fatty liver, cirrhosis, and so on and so forth. Liver and gut related issues basically span out of the liver inability to detox the toxins from the bloodstream. So liver, as as human being, we pretty much damage our liver in early ages, in our 20s and 30s. That could be drinking, some drug use, and even just the regular food that we eat. We never pay attention to the liver health. And because liver, whatever we drink, eat, or even inhale, the air that we inhale, all these things get detoxified by the liver. And so liver keep filtering all these toxins from the things that we eat, consume, or breathe. Eventually liver become overwhelmed with all the toxin that it accumulates over the year. So when we get to the age of 40, liver start to slow down and functionality is function, because it cannot keep up with all the toxin that is keep accumulating. So slowly things start to seep into our blood, all these toxins, the free radicals, environmental toxins, and so on, seep into the bloodstream, and these toxins end up in other organs, and that's why we end up with all these other comorbidities or illnesses, you know, as we mentioned, whether it's diabetes, hypertension, cholesterol, and so on and so forth. So what I did when I formulated first this detox protocol, I would just give it to my patient for free. They would try it for 5 days. When they come back, they would have these significant impact on their health and wellness. But whenever we would run a blood test, and the difference in the blood test would come back with a night and day difference, and that was the convincing point for me to basically give this protocol to everybody above age 40. So we had been researching this protocol for 7 years now. In all these 7 years, we learned so much, that how our body respond to this protocol, and what happened after a certain age, as to, for instance, if somebody had gallstone for so long and they started this cleanse after the age of 40 or 50, the chances are that accumulating so much stone, the gallbladder possibly had stopped working already and they're no longer function. So this cleanse stimulate the liver and the gallbladder to the point so it can bring it back to the normal optimal function. But when the gallbladder is no longer functional, then all these stones being accumulated in the gallbladder will lead to a lot of pain, because now this formula is stimulating the gallbladder, stimulating the sphincter of the gallbladder, allowing it to get rid of all the sludge that it accumulated, or all the stones that it accumulated. So if the gallbladder muscles are no longer able to function the way it used to be, it leads to spasm, and that spasm can create pain. So what we did, we lowered the bar for age recommendation, and we brought that 40 years to 30 years. So now the recommendation is that anybody above 30 and above must do this cleanse once a year. If you are 40, you do it twice a year. And if you are 50, at least you do it 3 or 4 times a year. Because it's not just the gallbladder, it's the liver that has a significant impact on overall health. And this formula helps the liver to clean from all the toxins and the free radicals. So the liver then, once the liver get overwhelmed with all these toxins, what happens is that the liver start to accumulate fat in the liver cells or hepatocytes. That accumulation of the fat then turn into something called the fatty liver. And the fatty liver, if it's not treated, then it get inflamed, and then it will become cirrhosis. So our goal is to basically take care of the liver before the fat accumulation started, before the inflammation start in the liver, so the liver can come back and get rejuvenated and start its optimal function again, as was doing in our 20s and so on. So the message is that, no matter who you are, what you do, you must do. There is no excuse to not do this cleanse. When you hear about this cleanse and you are aware of it, then it become incumbent on us to must do this cleanse at least once a year, if not more, because it's the liver, our gut health, which is responsible for majority of our illnesses in different elements that we succumb to. So once we take care of our gut, once we take care of our liver, that's why then we prevent those other illnesses from occurring.
This is so amazing. This is so amazing. So, in a nutshell, what he's saying is, as you age, your liver gets clogged up with toxins, even excess fat, right? That makes it less likely for your liver to perform the life-saving functions that it needs to function in order for you to stay healthy. This is so, so important. I recently heard a study that young adults, like in their late 20s, early 30s, are being diagnosed with gallbladder cancer. Have you heard this study on the gallbladder cancer and lots of colon cancers and things like that are just creeping up? And we know that these cancers in the gut are all connected to the diet, right? And so we're seeing this more and more. What do you have to say about this spike in cancer, specifically in the gut?
Definitely. So one of the things that I want people to understand is the mother of cancers is inflammation. Inflammation is the key. So what happens is that all these toxins that we mentioned seeping into the bloodstream end up in different organs. Gallbladders, one of the places where the liver produce biles for obviously to emulsify fats, proteins like meat that we eat, the cheeses and dairy products that we eat. So the liver produces bile, send it to the gallbladder. Gallbladder then, per the need of the diet, will release the amount of the bile that it needs. And then basically bile does its job to emulsify and digest those food products. But what happens is that liver also produce excess amount of bile, so to get rid of the toxin that the liver accumulated, and also possibly there might be toxin that it needs to be eradicated from the body. But what happens is that gallbladder doesn't work that way. Gallbladder release the bile per the need of the GI tract or the gut health whenever there are fatty food and so on. Another function of the bile is that if there is an excess bile that goes around the bloodstream and bind to cholesterol, such as triglyceride and VLDL, and basically remove those cholesterol from the body as well. Now, what happens is that if there is an excess bile being produced in the liver, sent to the gallbladder, then the gallbladder will hold on to it. After some time, if there's more and more bile coming from the liver to the bile, the bile would accumulate them, and slowly that bile get thickened, and slowly it becomes sludge, and then eventually over the years it turns into stones. So carrying that many sludge stones with toxin in it lead to inflammation of the gallbladder. And that inflammation then can lead to cancer, not only of the gallbladder, but also other tissues and other organs as well.
That's good. So now let's pivot and talk about some of the symptoms that people may experience when your liver is overburdened. I want to break this down in women versus men, because in women, I notice a lot more symptoms like estrogen dominance, increase like PMS symptoms like depression, headaches, bloating. Women who are perimenopausal experience tumultuous hot flashes. We see a worsening of endometriosis. We see a lot of fibroid disease. We see an increase in like acne flare-ups, worsening of like skin conditions like eczema, psoriasis. All of these things are linked to a sluggish liver, right? We also might see things like brittle hair, right? People who are just like aging prematurely, like wrinkly skin, right? Less energy, right? Because your metabolism isn't operating at its efficient level. We see like slow recovery from illnesses because the immune system is not functioning like it needs to, right? We see foggy brain, right? Thanks to that overload of a lot of people consuming a lot of pharmaceutical drugs, right? Sugar and caffeine, which also leads to the inflammation, right? We also see circulatory damage, right? Because of high blood pressure and high cholesterol levels, right? And then this excess body weight that people are carrying around. If you're experiencing any of these symptoms, you need a liver detox. Like, it is mandatory that you do this. This is not, I'll get to it. It is mandatory. We are living in a day where we're seeing more and more people, younger and younger, being diagnosed with cancer, dropping dead of heart attacks, and all kinds of things. And this is why I thought it was so urgent to really have Dr. Khan on, because I'm like, hey, I've done a liver detox, but I've never done a full body cleanse that includes the gallbladder as well. And he has formulated an amazing product, which we're going to share with you at the end of this episode. But before we share this amazing product with you, please tell us a little bit about Genome, the company that has formulated this product, how you got started with the company, and the technology that you're actually working on to really help improve the quality of life.
Definitely. So first, I want to spend a minute to talk about these different symptoms that you mentioned in the liver function associated with those things. You know, a lot of time that we go to our traditional medicine doctor and they would run LFTs or liver panel test, and in the liver panel test, I would say, well, your triglyceride and your cholesterol panel is normal, and so is your liver enzyme like AST and ALT are normal, and therefore your liver is possibly good. Now, there are deeper tests than those that which can allow us to see whether our liver is functioning right or not. A lot of time people would think that, okay, I don't have any upper right quadrant pain, so my liver is fine. I don't have any pain, and therefore there's no inflammation. Well, liver does more than that. As we mentioned, that liver could be doing in taking the hits and the damage for a very, very long time before it shows the symptoms. So the things that you mentioned, sluggish GI, gut health, and sluggish metabolism and digestion and so on, these are the things that possibly liver is not functioning at the optimal level. So whether it's skin issues, whether it's acne and others, or even depression, anxiety, and so on, because 95% of our good feel hormone, that's serotonin, produced in the gut. And there's another thing that is basically our weight. Our weight is also linked our gut, into the brain. So there is a hormone called leptin. Leptin is produced by our adipose tissues or our fat cells when we eat and when we feel full. Leptin start to communicate with the brain, with the satiety center in the hypothalamus in particular. Communication would allow the person to say that, okay, I'm full, I'm satisfied, and now you should stop eating. What happens is when there is a lot of inflammation in the body, there's inflammation in the satiety center, leptin is no longer able to communicate, or the satiety center is no longer able to respond to the leptin stimulation or response, and thus a person never feels satisfied with the food. So that's one thing. We keep eating, keep munching, snacking, this and that lead to all these bloatings and indigestions, constipations. When that happen, then the gut reduce the production of serotonin. So then we have anxiety, then we have depressions, and that cycle continue. And one condition lead to another, and basically a cascade of events started. And then we go to doctor, we treat one thing, another spur up, and then this whole thing basically continue like a roller coaster. So once we fix and optimize our liver, believe it or not, I've seen it in so many people that they have all these other issues. All these issues basically go away, and they feel just wonderful at every level. And oh my goodness, I never thought that all my other issues were also related to liver and gut health. But once you do this cleanse, you come back and you will feel it that, wow, this is amazing. I never thought of this. That's why we recommend this to people after a certain age. And it doesn't matter whether you have any symptom or not, but prevention is much, much better. And when did far more important than curing a condition. That's after a certain age, like at 30, we mentioned that you must do this once a year. And when you do this cleanse, it's a 5-day cleanse. So, I mean, everybody can afford to have 5 days to themselves for their better health. When you come back and after the 5th day or 6th day, and you start to feel the difference in your well-being, when you go and do a blood work and you see the difference in your blood work, you'll be amazed. And then people get convinced that they must do this more often than once a year. And that is totally fine to do it 4 times a year if one wants to do it. I've seen people that they do it far more frequent, and then I would tell them that, there's no need to do it every month, because once quarterly is perfectly fine. But there's no excuse, I should say, that somebody should not do it. Definitely recommend it for everybody after the age of 30, and to have a better health, to prevent condition from occurring later in life. About the company, so Genomics is a functional supplement company. The aim of Genomics is to basically have customized care, supplemental care for people with their customized conditions. In traditional medicine and others, we don't have customized care. We have a cookie cutter treatment for different conditions, and everybody's genetic profile is different, and thus their treatment could be different. That's why one drug does not, everybody's body doesn't respond to one drug or a single drug, and they have to take a multitude of different drugs and so on. So our goal at Genomics is to create genetic testings that one can do at their comfort of their home, and then they will see that what is actually going on. So the idea is that for Genomics is basically for longevity, and what we can do basically to have a better quality of health and have the longevity span. For that, Genomics is focusing on 3 areas for genetic testing. One is for inflammation. Inflammation is the key. So it is extremely important to get rid of, eradicate the inflammation from the body. And how do we know that whether somebody has an inflammation or not? And that's why we will have different biomarkers, genetic biomarkers, to see a person see that, okay, I have inflammation. Now what I do? We would have kits like this particular kit for inflammation that they can start in within 3 months period of time. They should be able to get rid of their inflammation. And once they're done with that, then they can redo this test again and see that they no longer have the inflammation. And then they will also feel it in their body that, okay, now I feel good. Another test is very important, and that is the telomere test. Telomere is one of the components of the cells that is measuring the longevity of the cell, and they translate to longevity of human being. So when you have a longer telomere, that means that you have longer lifespan, or a cell has a longer lifespan. When the telomere is shortened, that means that the lifespan is short. There are a lot of things, but one of those things is inflammation. That inflammation basically cut down the telomere length. So once you get rid of the inflammation, then you would have a good chance for telomere to prosperous. But we also have, when somebody measures their telomere, so telomere will be also measured by genetic testing biomarkers. When they see that their telomere is not as long as it should be, we would have a kit for supplements similarly that they can try for another 3 months. And then with a 3 month span, they will be able to see that, okay, now their telomeres got to the longest span it possible, and they can move on to the third thing, and that is the mitochondrial health. Mitochondria is one of the most important component inside the cell, because mitochondria provide energy for the entire cell to function properly. And when the mitochondria is sluggishing, or there is a gap between the mitochondria and the nucleus of the cell communication, then a cell doesn't function properly, and the longevity of the cell is basically sluggish. So cell dies quickly, and that also translates to the lifespan of the human. So we would have then a similar test for mitochondria and a similar kit for mitochondrial health to basically enhance the health of the mitochondria. So this basically, genomics is doing these different cutting edge technological, scientific, and research advancements, and with the hope of technology that we will be starting that soon, once we get a little further with our current business model.
This is so good. This is so good. So amazing. I love the bridge between technology and innovation and overall well-being. Like, that is like a sweet spot that I find that is just so intriguing to me. My heart is always, how can we improve the quality of life from the inside out? For 25 years, that's been my life mission, is improving the quality of life from the inside out, spiritually and naturally. So not just looking at one dimension of life, but looking at, the entire scope of a person's life, which is where the whole 360 life wellness model came from. And I use the wellness wheel approach to wellness when I help the individuals that I serve and support in the community. And so I am so excited to be introducing this amazing product. It is now available on myinsideoutlifestyle.com. I'm so excited. The kits are not available yet, because I'll be introducing the kits on the website very, very soon. Again, I'll be starting the 5-day liver and gallbladder kit on April 1st. And then after I've completed my 5-day cleanse, I'm going to be sharing a testimonial. I'm going to be walking individuals on how to do this with me. And then you'll be able to get those kits as well right on my website at myinsideoutlifestyle.com. It is an exclusive product. So you can't go to the store. You can't get this on Amazon. You can't try to piece together these formulas. It don't work like that. You only can get it from us. Definitely. So I'm just letting you know.
There are 3 different products. And these are for 5 days. It's a 5-day course. And so the instruction will direct you how to start and how to finish. Everything is in the instruction pamphlet.
That you will be able to get this on myinsideoutlifestyle.com. Inside are 3 easy steps, and I'll be walking you through how to do this 5-day cleanse with me. Again, the 5-day liver detox challenge. We're starting in April. I'm so excited, Dr. Khan, to be trying this amazing product. Do you have anything else you want to share with our audience today?
This is a very exclusive kit, and yes, indeed, even though all the ingredients in this kit are all natural, the way that we formulated this kit with 3 different products, it designed for each day is designed for different organs. So the 4 days that we focusing on the liver gets stimulated. Liver is starting to basically produce more bile and start to get rid of the toxin in the liver. The 5th day, we are then focusing on the gallbladder. The gallbladder is being stimulated. On the night of the 5th day, we're gonna open up the sphincter as wide as can. So in the morning of the 6th day, that's the day of the finale, the sphincter of the gallbladder is so wide open that when we stimulate it with the fat, and the gallbladder start to spit out a little bit of biles, it basically get rid of everything that it contains, whether it's sludge, stone, and bile, everything basically. So the gallbladder get very clean all the way because it spit out all the contents of the gallbladder at one time. And when the first bowel movement happened, then people will be able to see just bile. It's all green, and you would see gallstones in there. You would see sand in there. All the things that you want to get rid of, the gallbladder is ready to move out. You will see that in toilet on the first bowel movement.
That's amazing. So stay close to the house.
For that 6th day, we mentioned it in the instruction.
Okay.
Day 6, you want to stay home. Because
Okay.
those will be periodical bowel movement, and each time you will see more and more cleanliness.
Okay. Yep. Perfect. Quick question that I didn't ask. What do you recommend? So my daughters are in their 20s. Do you recommend that they do this at least once a year? I know you said you want to start in the 30s, but would you recommend it, or would it be okay for them to at least try this cleanse as well?
Definitely. See,
Okay.
what happens is that it's the early age that we basically damage our liver the most,
Okay.
because that's the time people drink a lot, do a lot of the things that which later on we don't do. So if you want to do it early on in 20s, there is no harm to it. The only reason that we say 30s, because young people normally don't pay attention to their health. It's people later on, 40s and onward, that they start to pay attention to their health. But we encouraging them even in their 30s to, hey, this is the time to start focusing on your health, pay attention, and this is the time to start. But 20s, if people are cognizant about their health, they're welcome to try, yes.
Okay, perfect. I just wanted to know, because I'm definitely going to make them go through it at least one round. At least one round. Thank you so much for joining us on Wellness Talks
Pleasure.
today. I look forward to seeing you soon. I'm excited. I can't wait to give you my feedback on how amazing I feel. All right?
Wonderful, wonderful. Same here. Thank you very much.